doctor friend on the Governor's Physicians Advisory Group, Dr. Hoa Nguyen. Good morning, Doc.
Good morning, Chris. Good morning,
Good morning.
Rena. How are you?
We're doing okay. It's Friday.
Could be better.
Yeah,
Okay.
So let's just start. We haven't talked to you all week, and I know there were like a couple physicians advisory meetings this week, right, Doc?
Yeah, we have two. We have one on Tuesday and one just last night. So, number one thing is that we just want to, the daycare and especially daycare, the information come out, I think, a little bit early than we thought it would come out, and I think it's just a miscommunication within, the PAC and public health. But I think we meet on Tuesday and correct it, so they would open at 50% is the enrollment. I think they have to go and correct that, and not occupancy, but enrollment. So I think that there's a new correction going to come out, so that way.
No, it came out. It came out yesterday.
Came out yesterday?
Yeah.
Okay, but 50% not occupancy, but enrollment.
Right,
okay?
for childcare facilities.
Right. And so that is I got a text from Doc Lonnie, one of our daycare friends, and we had a call with her earlier in the week, and that was a major problem, is that the capacity limits included the staff, and so it totally skewed their child to staff ratio. So I'm glad that was straightened out.
Yeah, no one gonna be functional with that 25% thing.
Right,
so
right.
I think everyone is kind of very happy to have them open, so they kind of triggered their finger a little bit early, but they next step to correct that. So I'm glad for the daycare center, because every one of us needs them, so that way people go back to work.
What other issues did you guys touch on, Doc?
We talk about, a plan, long-term plan, a short-term plan on the incoming passenger, domestically and international, just because, our island right now is very safe, but we have very little case, but on the incoming case, on the new case, most likely will be from incoming passenger. So we have to have a short-term and a long-term plan. So that's what we discussed about last night, and it's not finished yet, so what the short-term plans, to know exactly what the prevalence of the virus coming in. We're going to ask and discuss with public health to have the approval to see if we can test 100% of the passenger that incoming the next two flight, especially from the Philippines, because right now we have a controlled environment. They are all in the government facility in the hotel, so we can basically test 100%. After most likely what we come up with 10 days after confinement, just because after 10 days of quarantine, you will catch about 9% plus of any virus that you have. So we're going to have to discuss with public health and get approval to go forward with that, the testing in the quarantine hotel.
Was there any discussion about the military service members that had tested positive for COVID-19 that were staying at the Reef Hotel?
Yeah, we did, and I think the military did a pretty swift action. They kind of checked everyone, and I think they put it on base now. So, and I think the general also give a very strict order on off limit on bars, restaurant, and every place here for them. Just right now, just to confine them. So I think they're all off the Reef at Anderson right now.
Do you know how many service members were at the Reef?
Total, I think it's 8.
Oh, no, the 8 positive, but in terms of like how many were staying there, were everyone in the unit moved, or just the 8 in isolation?
I think 100% you moved. They're all confined at Anderson.
Mm-hmm. Do you know how many?
No, that number is kind of not privileged to us, I don't think.
Wow, not privileged?
Well, this is a security thing. I think that sometimes they can tell you afterwards. Right now, their job right now is just confined.
Security for them, but what about the security of the people of Guam?
But public health on top of them, though, they are working with them and tracing and do all the contacts. Anyone that, just like Dr. McClellan said yesterday, anyone that come even close to anything in that hotel will be contact, will be tests on all these people. So public health on their side, right now because we have a very low case, the tracing team are doing a very good job and try to talk to all the people that, like I say, when you come within in a confinement in a hotel, they will trace and test you. So at that part, public health are working. So we're very confident in their ability to do that.
Okay.
So I think that's it's a learning lesson as ever. This thing is coming every day. That's new. Like Dr. Mancona is saying, it's just basically the military have the ability to kind of confine people right away rather than ask for voluntary like we do. So it's something that we have to learn on outside too. One of the biggest thing that we talked last night is that we as an island have to be kind of respect the home quarantine and home isolation. We cannot legally, involuntarily put someone on isolation. We have to actually go to court in order to put them involuntarily isolation.
Isolation or quarantine?
Isolation. Let's say you have a person that's positive and they're supposed to be isolated at home. But if they violate the isolation at home, you cannot come in there and protect them and force them into isolation somewhere. You actually have to go to court to do that. So it's very hard, and people have to understand that if they have a positive test and they're symptomatic, they have to respect other people around them by isolating themselves at home. But this is very important. It's a livelihood of the whole island, because if you don't respect people around you and go around when you have a symptom and you're positive for COVID-19, you really didn't respect anybody. And we have cases like that right now. I think that so what the PAC does is we're going to recommend the governor and the AG office to strictly enforce the law, because the law say that you can basically fine someone $1,000 or 1 year in jail. And you have to do that in order to protect everybody on this island. Hawaii is 5,000 fine and certain time in jail. So, and they do enforce that law. So everyone kind of scared and respect the law. But we have to start to do that, because right now, as you can see, we test a lot. I mean, public health go out there and test everybody, and they have very little. So we are one of the safest place that you can live right now, and we'd like to keep it that way.
So having said that, Doc, was there discussions about the possible lifting of this public health state of emergency?
Yeah, I think we've core 3. People is sometime the end of this month. I think it's on the 25th or 26th sometime, guys. So when we're back to core 3, I mean, everything is almost back to normal already. We would not get to 4 just because we don't have a vaccine, no treatment.
But couldn't you be in P Core 3 with a public health state of emergency still in effect?
We just, I think, pending on this incoming flight. We really are nervous on income. As you can see, on the positive case so far right now, most of it is not because of our island. It's anyone that's coming in. So we just have to be very cautious in case if there's a surge out there because of the incoming resident. Right now, the only one that really are in the hotel facility is the PAL flight, just because Philippines is very hot right now. But again, if things in the U.S. are changing and other countries are changing, we just have to change as the rate of infection go up in certain areas. So can't let your guard down yet. Until then, everyone want to get out this emergency thing, but again, we don't want to take a step backwards either. I think once it's comfortable and we know what's the rate of people coming in, and we probably will lift that. But at this point, it's still a little bit too early, Sabrina.
Right. All right, Doc.
I know last week we talked about reopening of the bars, and you had explained to us the issues that you had with the reopening of them, and so now we open them 50% capacity.
Yeah.
Are you satisfied we're mitigating the measures? Because it went from 25 to, and I remember we talked to you, and you said that you were concerned that with the social distancing, and so I'm just wondering in the guidelines that they put out for the 50% capacity, are you confident that we've addressed those concerns that you had?
Chris, we have not had a chance to talk to the bar, the organization for the bar yet. So we probably will have to go back and invite them to the pack and talk to them. We talked to daycare a whole lot, but the bar one, I can't tell you. We have to go back and see what they did and talk to them to see, how safe it is. So and we kind of put a question mark in that one, but like I say, it's out there already. But we will have to go back in and take a look at them and ask them to kind of talk to the pack and see if we can assist them in doing something else to make sure that the patronage for the bar are safe to go in there.
We better hurry because they're opening in 7 minutes. The guidance said open 8 a.m. Friday.
Just like
I'm about to go get me a happy hour right now.
Just like the daycare, right? I mean, they it's okay for the open, but you can see the vast majority of daycare have not opened yet. They have to get the guideline now to go back and train their staff, and they're going to do in phase, right? They're not going to go 50% right away. They're going to go small, and they will every week they reassess themselves. And basically, they're going to increase the number slowly to 50%, but they're not going to open 50% today. Their staff will need to get used to the new guidelines. So, and those and the organization, everyone they care. They're so passionate. It's crazy. It's nice to see someone so passionate on their business. So our kids are safe with them. So. Again, dude, I'm not sure the bar open and get everyone in the same time. I don't know. We haven't had a chance to talk to them yet, but like I say, there's something that next week probably will invite them to talk to us and try to work with them to make sure everyone is safe. But we're gonna try to put some message out there, and I really need you guys to help too. Is really the quarantine isolation. Oh my God, it's really have to be very good on this one. We also will idea coming up, and I'm not sure it's going to be approved by the governor, but we like to have the mayor also get involved and help us in identify people in the village and make sure that if they, especially on isolation, that they stay on isolation. They cannot get out of the house if they're positive with a test and they're symptomatic. That's something that, to me, you got to respect other people. And the best part of each village is their mayor. Those mayors have lots of power, and they really like to keep the village safe. So that's one way we can explore. I haven't talked to you yet. That's some stuff that we just throw out there in order to make sure that we have some enforcement, some compliance, because the public health cannot be everywhere. They have a handful of people, and the island is big, and you cannot drive from Manila or north all the way down to the south to try to inspect someone's house.
Right. Well, I mean, I'm sure they probably would be more than happy to help out. I mean, they've been asking for more information and more transparency from this administration from the jump. So I don't think that's really going to be a problem. But I wanted to ask you, because you're talking about isolation and the more need to monitor, has this become a problem?
Right now we have few problem, I say here and then. We identified one case in the family, but I can't really tell you what the case is. But it's kind of I'll say the number, about 50% of people does not follow the quarantine rule.
Are we talking about
quarantine or isolation?
The home
quarantine.
Home quarantine. Okay.
Yeah, I mean about 50% of our population does not follow the home quarantine strictly, and that's something that for us to move forward and protect Guam, everyone has to be very compliant with that. You know, we like people to stay home. We like the people to go home, but at a certain point, people gotta understand that there's a big risk that they're going to walk around because they can expose everyone again. So, but now isolation is different. You know, isolation, if you have mild symptoms and you don't need hospitalization, they can isolate themselves at home. And, you know, that is where the most important part is that when you talk about isolation, means that they are test positive.
Right. No, I thought you said that you were wanting the mayor's help with the isolation and monitoring people in isolation.
Yeah.
Was it isolation or quarantine?
The isolation one, the most important one, is the one that you know you are positive and you are staying home. You know, so we can't on a free country you can't lock people up in a hotel involuntarily. You know, on this part, you know, so you can try to get public health will go out to their home, make sure their home is safe to be isolated at home, but we really like for them to stay at home for 14 days to make sure that they don't spread the virus to anybody. So that's something I think the mayor can play a big role in it. But we have, like I say, it's a thing we throw on the table to make sure that that's our long-term thing for Guam, because this thing not going to get over anytime soon, guys. Until we have a vaccination or we have a treatment, it's going to go on. So that's something that we discuss about. The other one the last thing we discussed about is behavioral health. You know, the last few months create a lot of stress on a lot of people with their job and all kind of stuff. So there's an increased case in drug use and alcohol use, and so we don't have enough behavioral health people on the island to help everyone. So we, Dr. Burke and the Guam Medical Board are trying to come up with some telemedicine and using psychiatrists off island in order to increase the availability of behavioral health specialists for people to call in and talk to them. So that's another area that we have to talk about in the past. So the meeting getting longer and longer.
Wow. Less time for fishing, huh, Doc?
And there's no fish out there. It's nice though. But guys, please pass out the message. Say people, please respect each other and help our island and our step in moving forward. And we are doing very good at this point. Okay.
All right. Thank you, Doc.
Thanks, Doc.
Wash your hands. Happy Father's Day.
Yeah. Happy Father's Day.
Thank you so much. Okay. Have a good day, guys.
Okay.
Bye-bye.
I'll see you. Bye. Dr. Hoa Nguyen, always great to get him on the show. It's not over. To keep washing your hands, and that's interesting. 50% of people are not adhering to the home quarantine.
Yeah.
You guys on home quarantine, please stay home. Maybe we got to bring back our stay home promo.
Right. It's also interesting that now you want the mayors to help.
Yeah.
Okay.
Hey, we're KUAM FM, Agani Guam. We're at the top of the hour. Good morning to our viewers on KUAM TV 11. We're going to take a short break, play our anthems. We'll jump into some news. And we also have Art Paris from the Guam Power Authority coming on to tell us how they're going to make it easier for you to pay those COVID power bills. That's all coming up right here on Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the